Hello everyone and welcome to this week's RCD ShareNet Disability Information video. This week's topic is autism spectrum disorder. So I'm going to be talking about what it means to have autism spectrum disorder, including some of the main things that clinicians look for when they are diagnosing the disorder. So I'll just get straight into it. So ASD, or autism spectrum disorder, is thought to have two main aspects according to the DSM-5. And just for people who don't know, the DSM-5 is the manual that clinical psychologists use when diagnosing mental disorders such as ASD. So the two main aspects of ASD according to this DSM-5 are: one, social communication deficits, and two, restricted interests and repetitive behaviors. So I'll go through each of these in turn to kind of explain what they mean. So first, social communication deficits. What does this mean? Well, basically, according to the DSM, this social communication deficits essentially mean deficits in social reciprocity. So for example, not taking turns in conversations, unresponsive in social interactions, not sharing interests with others. Those are all deficits in social reciprocity because it indicates that the person is not interested in reciprocating or kind of giving back what is given to them. So reciprocation occurs when someone kind of does something for you and then you repeat it back to them, or you do it back to them. So for example, when someone speaks to you, oftentimes it is thought to be polite or courteous to speak back, respond to them. But for people with ASD, this may not be as intuitive. It's not an immediate reaction to just respond to someone when they talk to the person with ASD, because they have these deficits in social reciprocity. So that's one aspect of social communication deficits. Another would be deficits in nonverbal communication behaviors. So for example, they simply don't utilize nonverbal communication and often just don't understand it. So things like facial expressions or eye contact or body language are all ways that neurotypical people use to communicate with each other, to kind of share information without actually using words. But for people with ASD, these kind of cues that most people use and are aware of unconsciously, for people with ASD, it's harder to pick up on them. So, and the third sort of aspect that the DSM mentions about social communication deficits is a difficulty understanding and maintaining social relationships. So for most people, social relationships are pretty core to how we go about life. We all have friends and we have family members who we care about, and it's part of how we go about life, participating in these social relationships. But for people with ASD, this is less of a core aspect of life, because it's not necessarily understood by people with ASD why people need these social relationships or engage in them as much. The purpose of them is not seen to be very clear, where for most neurotypical people, it's pretty intuitive why you'd want social relationships. So yeah, that sort of explains what social communication deficits mean according to the DSM-5. And now I'll move on to the second aspect of ASD, which is the restricted interests and repetitive behaviors. So there's a couple things that the DSM gives to describe this sort of aspect of ASD. So the first sort of trait that the DSM gives is a insistence on sameness. This means basically an inflexibility of behavioral routines, meaning it's hard for people with ASD to just switch habits at a short notice. They need time to adjust a lot of the time, and it's their routines are very rigid, and they want to stick to them to a T. And it depends how severe the ASD is, but for some people it can be very emotionally challenging when routines are disrupted, and it can be kind of disorienting and stressful. So yeah, it ends up becoming a difficulty coping with changes, and they can even become distressed at small changes. Another aspect of this restricted interest and repetitive behaviors is repetitive movements. So one common form of this is what's known as echolalia, which is basically when someone with ASD repeats or echoes sounds that other people make. So, for example, if you're talking to someone with severe ASD, they might just repeat your name back to you over and over again for apparently no reason, but it's actually just this echolalia occurring. Another example of this would be lining up toys in a particular way, or doing stereotyped movements such as rocking or spinning. Just these repetitive movements that they need to, not need, but it's sort of often soothing to people with ASD, from what I understand. Another aspect of this sort of aspect of ASD is the highly restricted or fixated interests, with an abnormal intensity and focus. For example, someone with ASD might just know a ton about local geography and just study it to a completely absurd degree to most people, but to them it's just what they want to learn about and what they want to do. So they become very fixated on this one particular topic that is really cool to them, but to other people it's like, why are you interested in that? So it kind of further contributes sometimes to the alienation of people with ASD, because they have these really out there strange interests that they become obsessed with. And they end up kind of knowing everything about this particular thing, but no one really wants to hear about it because other people aren't interested in the information. And finally, one final aspect of this restricted interest and repetitive behaviors is hyper or hyporeactivity to sensory inputs. I don't believe everyone with ASD has this, but it's common for people with ASD to have this kind of increased reactivity to sensory stimulation. So what hyperreactivity and hyporeactivity are basically opposite ends of the spectrum. So hyperreactivity means extreme sensitivity. So something that may not stimulate someone else would be extremely stimulating to someone with ASD. So for example, like a sound in a room that most people don't hear might be very pronounced and stressful to someone with ASD if they're hyperreactive. Or they might be hyporeactive, which is the opposite, meaning they receive less stimulation than average from the environment. So that small noise, or potentially now we could think of it as a noise that most people would react to, such as a loud bang. Most people would react to that pretty immediately, but someone with ASD who has this hyporeactivity might not react at all because it doesn't affect them. They just don't receive the same stimulation that other people receive. So yeah, those kind of cover what it means to have restricted interests and repetitive behaviors. So now that we've covered the two main aspects of ASD, I think to kind of wrap up this portion of the video, it's important to acknowledge that ASD is on a spectrum. It's called autism spectrum disorder. What does it mean to be on a spectrum? Well, it means that the disorder can kind of vary in severity between someone who might have, not ASD that's not too serious and someone who may have ASD that's extremely serious. And what determines the difference between those two populations is the severity of the social communication deficits and the restricted interests and repetitive behaviors. So that kind of wraps up this portion of the video, and now we're going to transition into our next portion of the video, which will be an interview with someone with ASD who has lived experience.
Hello, and welcome to the RCD ShareNet. My name is Dave Thompson. I'm the Community Outreach Coordinator and peer mentor here at RCD. And we are finishing up our ShareNet Disability Info series, and this week is on autism spectrum disorder. And you have seen the first part of the video being a sort of an explanation of what autism is. And we wanted to give, because we've had about 35 years experience dealing with people with different illnesses, disabilities, conditions, and whatnot. A lot of times you can always find the doctor's terms, you can always find descriptions online, but a lot of times you can't always find the lived experience. So that's what we want to kind of highlight. So I would like to welcome our guest today, Mairi Hallman. Hello.
Hi, thank you for having me.
And Mairi, you are a university student right now, correct?
Yes.
And you, I'm just going to sort of let you sort of explain. You had a sort of a unique way of sort of discovering your illness, or how did it sort of come about?
Well, it was actually, I was a bit late getting diagnosed, 17,
Right.
so
Okay.
towards
Yeah,
the
that's
end
what
of
I
grade
thought.
12, which sounds, it is a bit unusual, but it is much more common for females with autism. Tends to get found later. A lot of misdiagnosis, because a lot of the diagnostic criteria is based on males, and autism tends to present a little bit differently in females. So yeah, that was it was at first it was a surprise, but then as I thought more about it, I thought, oh no, that actually does kind of make a lot of sense, and it was nice to find out and nice to know.
You have so it's been since 17, so you've been sort of actively managing for how many years now?
I think coming up on I think it was March 2020, right around the time all the COVID stuff started.
Right.
I think it was the Friday after March 13th, actually.
And so we just want to ask we're asking some standard questions from people about how they live with their illness. And so I'm just going to get into those questions. And the first question is what are two aspects of your life that autism affects that people might not have seen on TV or readily know, or something that might surprise them?
Well, I think this is an interesting question because a lot of the portrayals of autism, or autism where they don't say it's autism on TV, are problematic for different reasons. Some of them, they are getting a lot better, which is nice to see. I think people, when they think of autism, they tend to maybe think of some of the more social or behavioral things, but that's really only part of it. The other main part is sensory issues. Being sensitive to light, sound, that sort of thing. That's a big one for me. I have a hard time with bright lights in particular. I don't like to go outside without my sunglasses. If for anyone with autism, I would highly recommend getting a good pair of sunglasses. Trust me, it'll save you a lot of headaches, literally and figuratively. That's a big one. Loud noises, yelling. When I was a kid, I would get really upset if anyone was yelling, even if they weren't mad at me. It was just the loud noise was startling. That's a big thing, which I don't really think gets talked about enough. And a lot of those things are it's easy to take steps to manage them once you know. But if you don't know, obviously that you can't really do anything to fix it. And then this is probably less unknown, but I like to joke, the two S's, sensory issues and stupid people. When I say stupid people, I mean people being ignorant and maybe not being, I don't mean people not necessarily knowing everything, because the information's not always readily accessible, and that's not their fault. And I'm not going to fault someone who's doing their best to try and learn. I think it's really great when people do that, and I appreciate that a lot. It's more things that just completely don't make sense, particularly at a systemic level. I'll give an example. I have academic accommodations for my exams at school, and sometimes I wonder if these accommodations are more trouble than they're worth. Like, I'm the one having to chase people down to make sure that my extra time is added properly on Brightspace. I'm the one who has to make sure that they know that the exam is open book and they're not going to tell me I'm not allowed to use my laptop. That just happened. I was just dealing with that for my statistics exam on that's coming up on Thursday. And it's really, I hope I'm not going off on too much of a tangent, but it's really just frustrating, some of the systemic barriers and how, I mean, I guess you can't see it if you don't experience it, but to me, it's so obvious, like, hey, this is a problem that I'm the one having to deal with this because I've already got executive function challenging as it is. Just doing my piece of the puzzle is not organizing things, making sure I've clicked all the proper buttons on my student account isn't always easy. So when I have to chase after the people who are getting paid to do this, that can be really frustrating. I think that, yeah, that I hope that didn't go too off track.
No. I had to do the same thing. I went back to school when I was 40 and I got accommodations as well. And a lot of times you had to sort of chase it down and it was, and I've also found that a lot of the universities, you have to do a lot of self-declaration when it comes to needing accommodations. So depending on where you are in your illness, how confident you are, you may not even know that those accommodations exist that you could have, and you may be scared to even ask about them because maybe you have scholarships and you think you're worried about them or something like that. So we did a study with a student about 5 years ago, and I found that there was a couple places that they lots of people were being helped in high school because they had care aids and learning aids and whatnot, but as soon as they hit university, they were all on their own to ask for those accommodations. So yes. Great, thank you very much. So I'm going to get to the next question, and that is, what are the most 2 important things you do to manage your condition? You kind of probably touched on it a little bit, but.
Yes, I think that I can understand this can sometimes be a financial barrier for people, but one thing that's really helped me is getting some tools that can kind of help me to manage some of the sensory things. Specifically, I've got my noise canceling headphones right here. The background blurring's making them look a little funny. But I got those after I was trying to do a linear algebra midterm, and my neighbors upstairs sounded like they were putting in an in-ground pool. They were drilling into the concrete, and that's not good for anybody trying to write an exam, but for someone who's sensitive to noise, it's especially terrible. So I decided to get these, and that's been really great. I also have just like the ear defenders, the kind of the construction type ones, which I got because I don't always want to wear these outside. Just I don't want to risk damaging them with how cold it is.
I wear the swimmer earplugs. That's the ones that I use because I have the same problem. So
I've actually worn the swimmer earplugs underneath these during exams if I'm worried about construction noise. The noise downtown, I live in downtown Ottawa. For anyone who's, I don't know what time everyone would be watching this at. This is February 15th, 2022. If anyone knows what's going on here, the noise has not been particularly fun. But yes, that I also have right here, these are called Theraspecs. They are kind of expensive, but this has really helped me as far as using my computer for things, because I'm studying statistics. So when I'm doing stuff with Python or R or anything like that, or at my student job with the government, it's all like coding and stuff. So doing that for too long, I mean, again, it can cause eye strain for anyone.
But that's for the blue light, they call it, or whatever?
Yes.
For the computer? Okay.
I think they're called FL41 lenses. I don't know if it's for blue light specifically, or I know that like people with migraines and concussions use them sometimes too. That helps a lot. And then I have my sunglasses for going outside. Just getting those few things. It doesn't sound like a lot, but it does make a big difference.
Oh yeah, like one of the best things I ever got was a seat cane, because I could go out and not have to ask where seats were and chairs were, and I didn't have to like give up shopping halfway through it because I was too tired. I had my seat cane.
Exactly.
And it's not a big deal. You know, it cost me $50, but it was huge. It was a huge thing, right?
Yeah, little things like that can make a huge difference in quality of life. And then another one that I think which I think is just maybe helpful for anyone, regardless of whether or not they have a disability, is actively deciding to cut out people who maybe weren't a net positive to my life, if that makes sense, because
Yep.
I get stressed about, with autism, social stuff can be a little bit hard. I get stressed about those things very easily. And it's not worth it. You've only got so much energy. I've only got so many spoons in my drawer, which is an expression commonly used by people with autism discussing like if they're like running out of energy.
The spoon theory actually was brought up for fibromyalgia. Now we're going to have a little bit of fun. So what are two things that really, or not, doesn't have to be two, what are some of the things that really make your day?
This is going to sound kind of boring, but when things work properly, like when when something that's frustrating just goes the way it's supposed to, if for anyone who's done coding before, you know, your code never works the first time. When it finally works, that is an amazing feeling. Being told I did a good job at something is really nice. Getting like validation that way, like, hey, you did a great job at this project or something like that. I think those are two big ones. Ordering takeout. I like to order takeout. Trying to think what when class gets canceled, that definitely makes my day. I'm not sure if it should make my day, but it definitely does. When something I wasn't looking forward to gets canceled, that's really nice.
Well, I think anything with along our sort of lines of illnesses is when you don't have to think as much as you usually have to think. Right?
Yes.
For me, it's just like take that thinking away, because I have to think so much more than anyone else has to think in a day. Because just a normal, simple thing is 10 thoughts for one person. It's 400 for me.
Yes.
So if I can cut that to 200, that's a perfect day, right? So I think it's very similar for you in you know, having to sort of just plan and prioritize and pace where you are and what you're doing. And so yeah, definitely that does make your day. So my last question is, what are some of the things that you would of empowerment that you would sort of tell someone else who's maybe just recently diagnosed or what else? What's some sort of encouragement that you can give?
What I would say is I would want to remind people that you're not an inconvenience, you're not the problem, you're not defective just because other people don't want to accommodate you or because the world wasn't necessarily designed for you. You have just as much a right to be here and to exist and have your needs met as anybody else. And anyone who acts like it's an inconvenience for them is, part of my language, they're just a jerk. You are not in the wrong. You are completely entitled to ask for what you need. And to add on to that, the squeaky wheel gets the grease. I think that the disability community as a whole is sometimes we're maybe not as vocal about our needs. And I think it's nice to see that changing with things like this, like talking to people, spreading awareness. I think we all need to stop being worried about inconveniencing people and start worrying about inconveniencing ourselves by not advocating for ourselves and not making our presence known and saying, hey, we're here. We deserve the opportunity to succeed too. So, and this is what we need to make it happen. And most people, if you tell them what you need, they're going to help you. You're going to get the odd irritating person who's
and a lot of times it's the trick is to figuring out where to find the information, because sometimes it's not always that readily available. It's like, I remember when I first couple of years of my illness, I said to my wife, I said, I know I'm playing a game here, but it seems like the rules change every day. If I just knew what they were,
so much paperwork,
I would play along. But it's like they change the rules.
Yeah, it's so much paperwork, so much red tape. It's all very frustrating sometimes, but don't be afraid to ask for help, and don't feel like you're inconveniencing other people by asking for help, because you matter. You're not an inconvenience.
Awesome. Those are actually very, very, very good words. So thank you very much. I wanted to give you a treat.
Oh, thank you.
I know that you're probably missing your dogs.
Aww.
So I will just say goodbye from Billy and I. Mairi has 2 dogs that are very similar breeds.
Yes.
So I thought I would give you a little quick puppy therapy
Oh,
online
thank
version.
you. Hello. Hi. Oh my,
And thank you very much for helping us out with this video. And I hope you have a good rest of your day.
thank you, you too. Thank you for having me.
All righty.